In this section, we're going to be taking a look at the concept of stress and coping. And stress is an everyday occurrence for every individual. And it depends on the level of stress, the types of stressors, and how the individual is able to cope with those stressors in their lives. And we're going to be taking a look at that in this section. The objectives are listed here that you can take a look at. They're also in the syllabus. And then we're also going to be taking a look at the student learning outcomes. And the focus of this section is providing safe, patient-centered, evidence-based nursing care for chronic and vulnerable populations guided by the Caritas philosophy. Second one is demonstrating critical thinking and clinical reasoning when providing quality patient care in community-based settings. The third one is to communicate effectively with patients, families, and members of the interprofessional team. And lastly, to manage care for clients and groups in diverse settings. Stress can be defined as the body's general, non-specific response to the demands placed on it by a stressor. A couple different types of stressors. The first one is a biogenic stressor, and this is something that is going to trigger the stress response without any necessary cognitive process. So you are not going to identify that you are undergoing stress. Examples would be caffeine, nicotine, and extreme temperatures. There's also psychosocial stressors, and these are environmental events. So a great example of a psychosocial stressor that everybody is experiencing is nursing school. There's also factors that are going to affect the individual's stress response. It's how the individual perceives the event or the circumstance and what their response is to it. When taking a look at stressors, you do want to take into consideration the severity of the stressor and then also the length of time of the exposure to the stressor. So in your textbook, Table 31-1 on page 1897, it gives some classifications and examples of stressors, taking a look at severity and timing. So obviously, the more severe the stressor and the longer period of time that it is going to occur, the more harmful that event could be to an individual. So also a couple of other things to take a look at in your textbook would be the types of stressors. There's a box 31-1 and also table 31-2. They're both on page 1897. You are going to want to take a look at those. The types of stressors just kind of identifies some of the commonly experienced stressors in any individual, and then the factors affecting individual stress response in the table. You want to take a look at the difference between the individual factors and the environmental factors. And then also with the coping process. So an individual is going to cope differently with a stressor than somebody else might. So nursing school is a very stressful event in your life right now. One person in the class might be coping better than somebody else, and you have developed different coping mechanisms in order to deal with that stressful event of nursing school. So when you're taking a look at it, you are taking a look at, you have a stressor, there's a primary appraisal, and that's an evaluation of what is occurring. So it takes a look at what is the potential for harm, the benefits, the threat, and the challenge to the individual. You utilize coping resources, so this could be internal or external. And then you do a secondary appraisal where you, again, evaluate available coping resources and potential options for responding to the event or the circumstance. You develop more coping. And then lastly, you do a reappraisal. And this is an ongoing evaluation of the event and the circumstance with continued evaluation of how you are doing with your coping strategies, if there's any more modifications that need to occur in order to effectively cope. Stress can be very overwhelming and can be very harmful to an individual's psychosocial and physiological self. So in taking a look at the manifestations of stress, you are going to want to take a look at Table 31-2 4 on page 1903. It does go by body system and what is the response that is occurring. So you can see that with cardiac, you're going to have increased heart rate and cardiac output in order to get more oxygen and nutrients throughout the body. You go into almost like a fight or flight, with the parasympathetic nervous system. So if you have, again, the intensity and the length of the stressor is going to be prolonged, you can see where harmful effects to one's self would come into play when taking a look at cardiac. So you're going to have an increased risk of hypertension, which can lead to stroke, heart attacks, and renal damage as well. So you want to make sure that you're doing an accurate assessment. And then when you're taking a look at nursing interventions, you want to take a look at how is the individual coping, again, and then also how are we going to promote the best well-being with an individual. So taking a look at page 1914, it is table 31-7, and it's wellness promotion for clients with stress-related disorders. And this relates to just generalized coping as well. So we're going to promote physical activity, we're going to promote sleep and rest patterns, adequate nutrition, and then time management as well. So you're going to want to take a look at that particular table and pay attention to some of the strategies that you would use in a client that is experiencing stress. An individual experiences a stressful event in their life, and their normal coping strategies are not able to reduce or resolve the situation. They are experiencing a crisis. It's an event or a circumstance that overwhelms their ability to resolve, manage, or process the event. And as the nurse, you need to be able to use the nursing process and collaborate with the interdisciplinary team in order to effectively manage and intervene for that individual. A crisis is an acute situation. It usually will resolve within about 4 to 6 weeks, and it is very individually defined. So what might be a crisis in my life would not be a crisis in yours. And it's something that every single individual will experience a crisis within their lifetime. With a crisis, it is an opportunity that can potentially have the individual grow. So typically one of 3 things will occur. An individual will cope with the stressor, it will resolve, and they will return to their previous level of functioning. The second thing that can occur is that they utilize that opportunity to grow within themselves and strengthen their ability to cope in the future. Or the third thing that can happen is that they will actually deteriorate to a lower level of functioning. And as a nurse, we want to make sure that we are able to intervene and prevent that third outcome. We do not want an individual to deteriorate because of a crisis that is occurring. So 2 different types of crises that can occur. There is situational crisis and maturational crisis. A situational crisis is an unexpected stressor or circumstance that occurs in the course of daily living. So there's a foreclosure on a home, there is a divorce, there is child custody, something that is an acute, unexpected event that occurs. A maturational crisis is what occurs normally as an individual progresses through the life cycle. So this is an adolescent that is having a difficult time establishing friendship. Looking at Maslow's hierarchy, that love and belonging might be a crisis event for that particular adolescent. They have a breakup that occurs. So manifestations, and again, knowing what your normal response to stress and coping is, these are going to be a little bit more extensive. So the goal of the nurse is to immediately assist and support that individual. So as a good nurse, you're going to let them express their feelings, you're going to let them listen attentively, and then the goal is to stabilize the reactions of the individual and maintain that process of adaptation, lessen the effects, so then they are able to effectively cope and have the resources that they need in order to achieve a higher level of functioning when, or a baseline functioning when the crisis resolves. So in taking a look, and also you're going to want to collaborate with the healthcare team. So it may be initiating counseling or crisis intervention, inpatient hospitalization, and maybe some therapy as well. But for the typical nurse, we're going to be doing several interventions. The first one is the therapeutic communication, and we want to make sure that we are communicating in a way that is going to promote and establish a rapport with that individual, be attentive, reflective listening, be very calm and open, use open-ended questions in order to stimulate the conversation and have the individual come to realize what the stressor is and what they also need to do. Crisis counseling the focus is on very brief solutions, focused interventions, and supportive care. And then also those ABCs of crisis counseling, they are in box 31-8 of page 1931, and it's achieving rapport with the individual, which we just discussed, boiling down the problem to be able to identify, validate, and intervene. So this is, you are, again, using communication to get the client to think about and start to identify what needs to be occurring and what their normal coping mechanisms were. And then lastly, to cope with the problem, have a resolution and a referral. So taking a look at both short and long-term needs and coming up with a plan for that individual. Also, crisis intervention is more of an emergency approach. This is a patient that may tell you that they are ready to inflict harm on themselves or others. You want to have the crisis intervention, or this is a client that comes in an abusive relationship and needs to find a temporary relocation in order to maintain safety. So crisis intervention centers are typically a telephone communication system that the individual will call into, and they will make contact that the crisis center will establish the immediate safety needs, and they listen, they explore perceptions of the crisis, identify coping strengths, and then to develop a supportive plan and a follow-up plan. Again, temporary relocation would be for somebody that maybe has a house fire, that loses everything that they own and they have no external resources that they can use. It's an individual in an abusive relationship that needs to have safety and relocation from that abuser. We're going to use the nursing process in order to manage an individual or a family that is going through crisis. And the very, very first thing, as mentioned on the previous slide, is maintaining those ABCs of the crisis counseling. You need, first and foremost, to establish a rapport with that individual or that family or that community. If you do not have therapeutic communication, if you are not attentive and reflective listening, you will not be able to establish that relationship, and therefore your interventions, your plan, your goals for that patient will probably not be as effective because they are not going to have that trust in you and in the system. So when you do an assessment, again, you want to make sure that you're assessing the individual to see how they are doing, how they are coping. Also, knowing that the family is going to be impacted by that individual's crisis as well is very important. So you need to assess the reactions of the family dynamics as well, or the social support network. And then the community. And the community assessment is probably more so for natural disasters that are occurring with community nurses. One of the role is to sometimes be the first on the scene in order to provide those lower level of Maslow's hierarchy, so food, shelter, water. So you want to do an assessment of the community in those types of situations. Diagnoses. A lot of different nursing diagnoses can be applicable to a patient that is in crisis. Probably the most significant in your priority would be safety. So identifying if a patient is in crisis, do they have any thoughts of inflicting harm on themselves or others? So that risk for injury, that risk for self-harm are going to be at the very top of your priority list. And then in planning, you're going to establish goals and identify outcomes for the individual, the family, the community. You're going to implement what your plan is, and then you're going to provide that evaluation to see if whether that goal, that plan has been effective, and whether you need to revise and go back to the starting block again. Also, taking a look at your textbook, there's Beck's 31-10 on page 1933, the do's and don'ts of crisis communication. You do want to be aware of that because, again, that establishing rapport with that individual and that family is of utmost importance. So you really want to be very effective in your therapeutic communication.
Post-traumatic stress disorder is a result of some stressful, traumatic experience in an individual's life. This could be having an exposure in childhood to either violence or abuse from that environment. It could be people that have experienced disasters and acts of terrorism in their lifetime, or it could be from people that have gone overseas and been a part of war. They come back, the veteran population. So there are specific risk factors that it has a tendency to predispose to this disorder or the PTSD a little bit more. That is the severity of the event, having little or no psychological support, and then a presence of a pre-existing mental illness. PTSD the recovery can vary from as little as 1 month to several years and a lifetime, depending on the traumatic event that has occurred. Clinical manifestations, they are in your textbook. There's actually a very good chart, and it's on page 1947. The clinical manifestations are in there as well, but just to highlight some of the ones that are probably a little bit more frequent that occur are the sleep disorders, flashbacks, trouble with affection, aggression, or violence, which you have to pay particular attention to make sure that they are not at risk for harming themselves or others. Avoidance of social contacts because it may trigger some of the flashbacks. Depression, drug and alcohol abuse. Very common with some of the individuals at the shelter. They are veterans, and when they came back from the war that they were fighting, they had a hard time acclimating back into the community, and they resorted to drugs and alcohol abuse that led to the cycle of homelessness. Collaboration, make sure that as the nurse, you make the individual aware of the resources that are available, both financially and medically, and that they do have access to food or shelter if they are struggling with poverty or homelessness. Therapy center around a holistic approach. It includes cognitive behavior therapy, supportive therapy, group therapy, and then also pharmacological management, including benzodiazepines, antidepressants, antipsychotics as well. You want to do a good assessment of the individual, but you do not want to ask particularly about the event. It can create an instant barrier to a therapeutic relationship, and it can actually cause aggression and anger in the individual. So you want to assess how they're coping, but not specifically about what happened with the event. There is an assessment interview in your textbook on page 1948 that you want to take a look at, because these are some good questions that you can use to help assess what is going on with that individual and how they are coping.